Some people will experience great levels of intensity in terms of the physiological symptoms, but maybe not the cognitive symptoms, or vice versa. And so there's a kind of broad spectrum of experiences of anxiety. But I suppose if I was trying to pin it down and give you a textbook
Mm.
definition, that's probably what I would say.
So if you were to think about, let's say, I know you work with a lot of teams and individuals in let's say GAA, for example.
Yeah.
So what are some of the common descriptions or ways that anxiety manifests for those sports people? So for those listeners who are not familiar with GAA, it's an amateur sport in Ireland, played at a particular high level at, uh, amongst counties, but within clubs, it's all amateur, volunteer based sport,
Yeah.
and it's very much a part of the community, and people love to be involved. But it is a highly competitive sport, and we love the game. And so,
Mm.
when you're working with people involved in the game, what are they saying to you? How does it arise? How do they just describe it?
Well, again, players will report slightly different things, but generally speaking, I think they can kind of fit into one of three camps or some sort of combination of those camps. Some individuals deeply experience the mental cognitive manifestation of anxiety. So, a thought of doubt or worry or some concern about an ability to cope or perform in the future sets off a chain of motion of pessimistic thoughts, of
Mm,
negative thinking, of catastrophizing. And it goes from missing a pass to getting kicked off the team to not having your career to your wife leaving you. You know, we spiral very
okay,
quickly
I
there,
shouldn't laugh, but because I know it's serious for a lot of people. Yeah.
100%. But it
Mm,
does when you're outside of it, it can sound ridiculous at
mm,
times. But when
mm,
you're in the middle of it, there's a logical progression for those points. And sometimes
mm,
you have to kind of have a look at those links in the chain and see if they're as
mm,
strong as the individual client is feels that they are. So that's one element. The thought process can go awry, and the
mm.
inside of somebody's head can be a dark, difficult place to
You
inhabit.
said it. You said it.
And
Mm,
so that can be one. And another thing that we see very commonly, and I particularly see this more often with male than female athletes, and I think there's elements of stigma that people are aware of that may explain this. And they may not report pessimistic thoughts, doubtful thoughts. They may not report a busy, internal mental experience at all, but
mm,
they may report certain physical symptoms.